start.
Okay. Good morning. How's everyone doing? Good. So I'd like to start the City of Laredo Blue Ribbon Committee for People with Disabilities. Today's February 15th, 2023, and so the first item is the approval of the minutes for October 19th. We never approved these minutes, Tiffany.
No, because we didn't have
Okay,
to.
can you all? For those of you who are here, please go through the minutes and indicate any changes or revisions that we may need to make. Thank you.
Is this the DECA meeting?
No.
Oh, no, their meeting,
In the auditorium.
I thought Joseph was gonna fix signs.
We need to take pictures of ourselves so we can compare it from one meeting to another. I'm sorry.
Can I read this meeting?
Probably Bates.
We get younger?
No, younger, better. Nobody in this committee looks fat. We all lost weight. Especially those of us that went to the Mexican.
I'm going to ask you about that. Have you posted pictures on the...
I got late. I'll share it with the committee. We had total of 95 participants that came in, but not as many as we expected. We had calls from people that said, you know, it's kind of go because we were afraid that someone was going to come. But yeah, it was good number.
That was still good for the shoot.
Yes.
If COVID's still out there.
Yeah.
We'll always be just a matter
So
of.
they did.
When we're gonna get it?
They put them together.
Okay.
I haven't got it.
The letter of appreciation is there.
For you to
On the agenda for this meeting.
Yeah, I wanted to go Friday, but I had my mom with me.
It's okay. You should have put your
Mine, no. She's 89.
My father's in 94, and I know 98.
My name is Alan. We try to keep her from. She doesn't love this. Salud, how you know you can.
So we're doing
They were doing an amazing job putting that up. We left at 2 o'clock in the morning. And on Friday.
No, Thursday.
Thursday, that's Thursday.
Yeah, we're not struggling days in the night.
But it was
venue is so beautiful.
We signed up for next year, February the 9th.
Yeah,
So
we're on.
Save the date.
Where was the other? Oh, is it very
Very nice. Yeah, they're doing the decorations.
We're doing a committee, right? We're doing a
Yeah.
committee this year, so everyone's will meet and how we
Get it.
So, are there any changes to the
No, sir.
minutes for October? No, if not, so can I have someone motion to
I'll
approve?
motion.
And someone a second? Thank you. So we have motion and second. Minutes are approved as they are for October 19th, 2022. I'm getting my ears mixed. Okay. Next item is, are there any public comments? Did anybody sign up for public comments? No? Report from Christine, JS Special Needs Program.
Morning. I'm going to keep it brief because I do have a presentation. As far as our program, I always say our program as we staff it. I know our program, the FSCR, is only solely me, but I like to report it as our program was received Autism Exercise Specialist certification in the month of December. We went through a series of workshops as well as CEUs to receive the certification to better work with the autism community to work with physical activity and fitness programs. Our health department was awarded an ASHO grant. This is addressing the needs for people with disabilities in COVID-19 and emergency preparedness. I have Ms. Iris Mendez here, who is on board with our program. I'm happy
So
to
now she's a team of two.
Yes. Our program is collaborating with the fire department to bring the STEER program into fruition for our community. The STEER program is the State Texas Emergency Assistance Registry. It's a program that's derived out of the Texas Department of Emergency Management. We are working to get that program to Laredo so that we can help register individuals with disabilities into that database. So if their area is affected by a Texas natural disaster, we have better outlook of what the area needs as far as what medical supplies are, and medical equipment we might need, or what type of response we might need from an emergency management team.
So, does that include both physical as well as mental health?
All disabilities, yes. So we do, the STEER program does collaborate with providers, nursing homes, as well as individuals that are independent living. So they work in all realms to just better help prepare that area. And of course, the database, the data collection that is developed through the data custodian that supplies that information. They get as much information as they can. So the application is lengthy, but the data custodians are trained to help and assist the individuals filling out that information or the caregiver that's filling
May I
out.
ask a question? In your database, are you talking about the survey of people that might need assistance in the community, or?
Yes, so the data custodian that is certified to have access to the data collection, they are collecting a application that is filled out by the caregiver or the individual themselves. It's very thorough, contact information, basic information, medical information, emergency contacts, as well as their capacity of mobility. So there's very thorough questions that are in that application to help better the response from emergency.
I was thinking in terms, I love Venn diagrams. There's some common area between, I was thinking, identifying the people that might need your help or in case of an emergency. And I'm thinking, do you remember, Mr. Chair, the police department presented to us that they were in the process of identifying what people lived in our community?
Correct.
Remember?
Correct.
That might have the household that might have a person with special needs. And so that they can be aware in case of a response, in case of an emergency, that they would respond appropriately. And I'm thinking maybe there's some gray area where you
Yes.
can give data.
So those forms that are done, we partnered up with PD Fire in that venture of the response. It's an assistance response form. The assistance response form is more of the law enforcement response to that location. What we're trying, our goal for that is if there's elopement or if there is an individual there that might not, again, the response and the recognition of that condition, because again, they're non-visible and visible disabilities.
That's huge.
So both are very different in response, so that's why we need both type of programs.
I think one of the things we brought up before when we spoke to the police department was specifically people on the spectrum, for example, that may not respond whatever normal is, as others would. And could that be misconstrued and maybe have some kind of terrible, occurrence because of the misunderstanding of the special needs of the community member?
Yes, and our goal as far as this project, the technical assistance that we've applied to the Laredo Police Department was bringing in ACOG, which is the Alamos City of Governments, to come do the training. That's a Texas Commission law enforcement training that's accredited to them. This training is in response to IDD and recognition. So not only are we doing the forms and better, flagging the addresses so that we're better at the response, we're providing the training as well. And the individual himself, which is, I believe it's Mr. Rangel, which is the training from San Antonio, he not only does the training, but he has a son that has autism. So he's actually, he's been with Bexar County Sheriff's Department for more than 15 years, and now he's with ACOG. So.
And this is huge because we've had this as a concern several times in our community through the years. So that's extremely important.
We had a 2-session training for different shifts of law enforcement in the month of January. We got great feedback. It was I just in the introduction alone when we went into the training, the icebreaker that Mr. Rangel had was eye-opening. It was very eye-opening. Everything from reports from the individual, because if there's an incident at home and they have to do a report, how do you receive that report? Because there's a communication barrier. And everything from expressing the response. So it was a really great training that they were providing.
That's huge. What you're doing is huge.
Our program hosted a workshop understanding SSI and Medicaid and SSDI, which is the supplemental income from the Social Security Office and Medicare. For childhood disability benefits, we had 152 participants in that hosted workshop. And then our program was selected to be part of a cohort number 4 group for the UT Texas Centers for Disability Studies and the Hogg Foundation of Mental Health. I'm part of a cohort, yes. But this training that I am currently taking is in the Studies for the Road to Recovery. This is to support children with intellectual and developmental disabilities who have experienced trauma. It's called the R2R. So once I graduate this month from this training, I'll be able to host 2 yearly trainings here locally. And then also connect with local or outside stakeholders, child psychologists to come help me educate the families. And as far as right now, we are at 680 clients of Q2, which is putting our program at 800% of the target client rate. And that's my report. Oh yes. We had an application to the NATIO grant that IRIS is currently under for the addressing individuals with disabilities through COVID-19 and emergency preparedness. This scholarship we applied for was to have 3 representatives from the health department attend a summit in Atlanta, Georgia, for emergency preparedness, and we were awarded. So we're going to Atlanta. So yes, and that's our report.
So are you going to get to go to Atlanta?
Yes.
On your dime.
She quickly has.
First of all, I just want to thank you for continuing to refine your skills and you continue to train and educate yourself in order to provide better service to the community. So thank you for that, Christine. You talked a little bit about the training that the officers receive in order when they were the first responders. Do you know what percentage of the police force has been trained? I think it's the CIT training. It's a crisis intervention training, so that they know how to handle emergencies when they deal with individuals of intellectual or physical disabilities. Okay, so I'm just wondering what percentage of the police force has been actually trained. And the idea, of course, is that there's somebody on staff, a mental health officer that's been specifically trained during every shift so that they can respond appropriately. Because not every officer is trained or can be trained.
Definitely. Right now, the mental health unit that's under Sergeant Garcia, we do have a collaborative efforts of responding to that in different shifts that PD has. So they have their shift mental health unit staff that are by shift, so that they're addressed throughout the day. But we do collaborate where if they have any questions, concerns, or they're trying to connect family to resources, they do connect with our organization or our program, so that we work on that end to assist the families aftermath. And as far as the percentage of cadets or field officers, I don't have that, but I can report back to you with that percentage or get a number of what we
And the
have.
only reason I'm asking is that I know that unlike other communities, okay, we have a very large police force who's been specifically trained, okay. All cadets go through a 16-hour training, okay, just because of the mental health or how to deal with disabled individuals. But there's the CIT, the crisis intervention training, which is a 40-hour. It's an all-week training. And I know that sometimes for not only here, but in many cities, it's very difficult because of the staff that they need to invest literally all week and not working out in the field. And so that kind of like is a challenge for every community with the police force. And so I'm just asking, I was just curious if you knew how far advanced or how the percentage of officers have been trained.
I don't have the percentage or the number, but this was a pilot training that we were working on to also invite school district police, county police, and sheriffs. Our goal for the next round is to coordinate with these other law enforcement organizations, entities to come in and come on board. The goal is to see how we can implement this towards the cadets' education, entry education. So we are working on seeing how we can plan these trainings, because other than this one, they have an X amount of other trainings they have to complete through the year with law
Remember when we
enforcement.
were training, we came across that, and they told us, well, you have to train by like teams that they had during the day. And I think we had like one team, after all was said and done. I was looking at that, I think like one group.
Yeah,
It's hard to get.
the issues like in San Antonio and your larger cities, you have internal police officers that are able to train the trainer, right? They're able to train. And so they've grown to that capacity. In Laredo, at one point, we were sending officers to San Antonio to be trained, which is extraordinarily expensive because you got to put them up for a whole week. So then the idea was at that time was we brought officers from Houston, and they provided the training to every law enforcement and every first responder, and it was the sheriff, the school districts, the universities, anybody who wanted to come. But I think until we are able to find somebody internally or within the city who can do that, it's going to be a real challenge to train possibly the entire workforce, because it's just a challenge
Yes,
to
and
put somebody there for
as
40
far as the
hours.
solution we found for that, ACOG has been working with us. We've partnered with them, and as far as when it comes to law enforcement training, that we have a grant. They have a grant where everything for us would be free. So we just coordinate with them as far as scheduling, and then being able to connect with law enforcement organizations here to make sure we have the group set and work with their schedule. So that's the temporary solution. I know the long-term solution is sustainability of having master trainer here. We have asked questions as far as to Mr. Nangel, as you know, how he became. He's been doing it for 14 years out of San Antonio. So much of his training is from his experience, and then also creating a handbook. And he's still in the works of creating that handbook. So as we continue going into these trainings and working with the law enforcement, especially ACOG, we can continue asking that question and coming back to it saying, when is there going to be a master trainer course? So, Alamos City of Governments.
I have a question. Could something be suggested that maybe we always have new academies? You can't change the past, but you can surely change the future. So incorporating trainings during the cadet training, because I know that I have a couple of friends of mine whose children just went in. I say children because they're young adults who went into the police department. that can be something. Even the fire department, my nephew just went into the academy. So training them during that and incorporating a part of the training and collaborating, I think would solve future problems.
Yes.
We still have these ones to address, but that would take care of it.
Yes, part of our, right now, as far as our post training, what our questions were is to implementing it with the newer cadets so that they already have it coming into the field. And then also working on the current law enforcement staff that we have to work with their shift schedules. Because that's what was kind of difficult, is making sure that we work with shift work.
What they had told us is there's a finite number of hours and, to fit in something, because I remember we talked about that before. But you're right, the beginning would be good.
Again,
And-
right now the
and-
solution I'm sorry.
And the training is very good in the sense of they educate you in the 16-hour training about mental health and what are the diseases and how they manifest themselves. That's fine. But one of the things that they do, why it's a 40-hour training, is that they actually put you through a mock situation. They literally, and some of us get to play client, right client, mentally ill. And so we can be as stubborn as we want and difficult with them as we want.
That would be therapeutic for the person doing the work.
And so the person gets to be assessed by everyone about what their approach was and how they handled the situation. And needless to say, not to mention that with the situations that we have throughout the country with the police forces abusing their position or the situation, that becomes real critical and important to every community to make sure that their officers are trained to avoid the situation like you see on TV sometimes. Anyway, I know that you were going to do.
No, I heard a noise. I was like, computer. Sorry.
That'd be fine. The floor is yours.
I do have a bullet point here with Home Life Community Overview. I'm going to give a brief overview on this topic that was brought to our attention when it came to the Autism Coalition. Yes. And then we're going to request for them to see if they approve. Home Life Community, they are a nonprofit organization out in Florida, and there's also a new location here in Texas, where this individual that is building a community for individuals with IDD, physical disabilities, and other cognitive disabilities, neurological ones, so that they have a better community-based service around their lifespan. He noticed that there was a lack of community-based services as well as housing options. So he went into this venture of creating a nonprofit and developing that himself. He's an architect, and there's a big story. What we're going to do at the end of the meeting is share a link of the organization to the Blue Ribbon Committee, and so that we can further go into it and learn a little bit more about the organization. So there was topics of housing coming up from the Autism Coalition in regards to bringing such organizations or stakeholders to do that care, because there was a lot of adults that were being left out, or they don't have housing options. Sometimes the care gets difficult for them. So I had the opportunity to meet with David, the executive director for Home Life Community, and we touched base on some topics of questions that I had on how this type of community can be built here in Laredo, or what are the obstacles he went through. So he was mentioning to me that he's currently working on a how-to plan so he can share with other communities just like ours that are interested in it. Much of the information that I did ask was what is the lifestyle like in these type of communities? Who do you accept and how do you accept them? Because we want to know about how low, moderate, severe the disability can be, so that they could be in an independent living situation. So he did mention to me a lot of what he had been struggling with when it comes to legislative outlooks, meaning that in severe cases or severe conditions, it's the care for that type of individual would need 24/7 care, nursing care. And sometimes, depending if it's a neurological condition, it could lead to a behavioral a behavioral condition, even a physical condition, where the individual will lash or hit or, towards their nursing staff or people or individuals around them. So much of what he's developed is only for low to moderate conditions. I had asked him, is there any outlook of possibly sharing or looking into doing it for severe individuals? Much of what he educated me on is that in the state of Texas, legislators deem it as if you have individuals with severe conditions in a housing environment that has 24/7 care, it's considered an institution, and they do not allow that. So much of what he has is for low to moderate conditions, and the community itself. Whenever you go into the link, you'll see graphics, videos of how houses or apartments, condos are made, and individuals are thriving, living independently, but they have monitored care. And then they go off to school or go off to work, and then they come back and they're able to continue having assisted living.
Interject something real quick? And I will take up a lot of time. There's a doctor in San Antonio who has bought, if anybody else is familiar, jump right in, like about 3 city blocks of houses that he's revamped to be 504 accessible. And what he's doing now is he has a group of caregivers, he has a group of therapists that go in and they support these people with disabilities. And it works out really beautifully, because what happens is these people have a feeling of, I'm at home, because it feels like somebody's home. And when they go to have something to eat, they go to the kitchen, and of course hand cooks, but it doesn't feel like an institution. I just think in terms of, what if I were there? Would I rather be in what you stated, an institution, or in a situation where there's like several houses down the block that if I want to go visit my friend, I still have the support. I'm just going a couple of, but I still feel that, that like support within the neighborhood. And, maybe we could do some, I don't know, that's
We
just an
can
idea.
continue.
There's a doctor who's doing that in San Antonio. Of course, his is for profit.
We can continue asking questions and exploring the options of getting this information, because of course this isn't a project that will be derived from the health department. It's a project that we need to encourage local stakeholders to partner up in. Yes. And much of again what he was mentioning is that they explored a lot of avenues, and some of these avenues is like what you were mentioning, but the struggle and the challenge that they came across that was the cost.
They I say this is private.
Yes, so it was $8,000 per month per individual. Again, we look at the access to care, and then we look at the financing of the service, and Medicare would not cover, and so majority of our population is under Medicare.
What I thought he did in a very smartly is because he has, I don't want to say a captured audience, but it's several people who need, for example, let's say physical therapy. You see, so he can kind of save money on, because lack of travel, everybody's there. There's group therapy part of the time.
Definitely. I mean, there's a lot of options and questions we can explore. What I would like to request from the committee is to see if we would like to invite him to our next meeting to see if he's available, and we can.
Tell me his name again.
I can't say his last name. It's a very unique Kowalski. Yes, we're going to go ahead and email you the link, and then also his information, which is the executive director, Mr. David. And we can coordinate on our next meeting to meet with him, and then possibly do some research on our own, and then have some questions ready so that when he's on the call, we can learn a little bit more about this nonprofit organization. And like I had mentioned, his goal is to share this plan. His goal is to make sure that other communities are benefiting from this type of project that they're working on. They're currently
Christine,
working on.
there's another program that you might want to explore. It's called Spark, and it's in Waxahachie, Texas. It's an assisted living center. They actually created a community everything that you can think of, but it's a beautiful facility, and it's called, I want to say that it's called Daymark. Okay.
Private?
It's, I'm not sure if it's private, and the only reason I know about it is because my son lives in that specific area. It's called Buffalo Creek Assisted Living and Memory Care. But
Buffalo Creek.
Buffalo Care. I know Buffalo Creek Assisted Living and Memory Care. But it's it's a beautiful location. You walk in there and it's houses, you know.
That's what I love about
yeah.
this one. It feels
So like
you're
a
in
plan, like a
neighborhood.
plan
It's
community
not
where they
like
can
an
go to work if they're
institution,
able
you know.
to.
Yeah, it is.
And much of what Home Life Community has, and you'll see it on the website, is the architecture. Our architect again had the idea, built this community, and it's beautiful. You'll see the homes. You'll see a community center where they can meet, and it's a recreation center, and there's a lot of options. But again, much of the individuals are low to moderate.
And building it is very expensive, but if you take homes that are already there and just, get the grant or whatever to make them 504 accessible, and then hire the staffing and try to, be very careful with your money to where you don't spend gobs of money, but maybe facilitate care in like a group situation.
Definitely. I mean, we look at all the resources we have. It's just teaming up together.
Yes.
You have home modification grants that organizations have.
Yes.
You have
have
maybe
that.
organizations that want to donate land or donate houses. It's been done before. So it's just really first learning about the plan that he has to see how we can incorporate with our community and connect
And the
these
community is
resources.
different, yeah.
And maybe you'll incorporate, I don't know, maybe Habitat for Humanity. I know I went to a
Yes.
round table in San Antonio years back when I was a contract manager at the Workforce Board. And the Toyota was there, and they had the San Antonio Independent School District there. So they had the individuals who did the trades, right? Electrical, construction, and the construction part of it, they were building the tiny homes for the homeless people. So they're learning, while they're building, but that could be a collaboration, just like we did the mobile unit when I was at the board. We got the IT people involved to redo the mobile unit from South Texas, United South. Then we had the automotive folks strip it and paint it. The graphic designer, we worked with the graphic designer at the school, and they did the whole wrap. So if you incorporate, you bring in community.
And if you think about Laredo College, they have so many licenses, whether it's carpentry, welding, whatever
Yes.
it is.
So you bring in those partners, right?
Like CEUs in order, and then you practicum.
Yep.
So we could include.
Yeah, we already built it. Let's talk to this guy.
So I'll work on sending him a follow-up email to see if he's available on our date for the meeting. If he's not, I'll work with him to continue trying to make it into one of our meeting sessions so that we can again do a little bit more research on his on their initiative and then be able to ask the questions for
Very
him.
nice,
And then,
Oh, there's more.
yes, there's a lot more. I'm sorry, I'm going to try to keep it brief. But let me know if you have any questions. I'm happy to stop and answer questions. So All Kinds of Minds master plan overview. This is the overview of the master plan we're currently creating. The table of contents on this master
If I
plan.
could just interject, this is already item 5. So she is reporting now on the All Kinds of Minds master plan. So we're jumping over a little bit for the sake of continuity. We'll let her proceed. If that's okay with you.
Yes.
Thank you.
On the master plan, we do have a message from Dr. Chamberlain in regards to how we are paving the way to a better society with this master plan to focus on people with disabilities. It does mention that we are looking to replicate the Blueprint for Change, which is a framework that the National Center has for children and young adults with special healthcare needs that focuses from childhood to adulthood. Our current local analysis that we have, we got information or we received information from the TEA, which is the Texas Education Agency, for the special education reports. Here you'll see in this graph the percentages of the category of the disability. Right now we do have 37.6, learning disability being the most prominent out of the other disabilities, and then of course it goes on from auditory impairment, autism, speech impairment, emotional disturbance. We also have the outline from the latest report that the Texas Governor's Office has, which is in 2019, for adults and senior citizens with disabilities. The current state analysis, right now we've received the information for the adults in Texas that have disabilities. We have we have 5,435,000 adults in Texas that have a disability, which equals 1 in 4 adults in Texas. And then we have also for the children and the youth, it was projected back in 2021 that we would have 1.2 million children. Again, we put this information out there to show the extent and it being vital that we have this master plan, because the numbers are not going down. Yes, they're increasing. And so we also put out there as far as the healthcare costs for the families and the individual. And again, with the cost of healthcare going up as well, I know legislators are trying their best to look at assisting families with more programs and more funding opportunities. But even with that, the assistance to obtain that is difficult to find or having the resources. Why a master plan? So here we discuss the importance of having these critical areas of a well-functioning system in our master plan and what it's going to do for our community. So we do talk briefly about the development of the framework that we have here and how, of course, it's to promote equitable access to the opportunities and services of full participation in our society. The Blueprint for Change, as I mentioned, is the national framework that we are basing our master plan, but it is incorporating more information on adulthood. So the 4 critical areas that the Blueprint for Change talk to us about is quality of life and well-being, which is community inclusion, access to services, financing services, and within these 3 areas of focus, we create health equity. Again, the quality of life and well-being includes recreation, includes the education, the technical assistance, and the partnership building.
You know what, Christina, if I can make a note, you know what's very important, and I don't see that it's here, employment, employers.
Yes, quality of life and well-being.
Is that
It
there?
includes
Okay.
the whole,
Okay.
Vocational training.
yes, and we'll go further into it when we go into the next slides, because it's just briefly talking about the 4 areas
Okay.
of focus of what the master plan is going to be creating in its system.
If I can interject in here for this. So this presentation is being provided by Christine, definitely for feedback from all BRC members. This is a presentation that would then be revamped and based on your feedback today, presented to Autism Coalition tomorrow, and ultimately to City Council on Tuesday. So feel free to provide
Yes.
as much feedback. We definitely want to catch these things right now, so that if we do get any questions from council, we're prepared, and we will advise them that this was, vetted by BRC, which you all are subject matter experts on this realm. So any feedback's welcome. Feel free
Yes.
to.
The vision for the master plan is to create a community where all people with disabilities have access to the care and services they need to have the opportunity to lead a healthy, productive lives and reach their full potential regardless of their healthcare needs. Here on our goals for the master plan, we do discuss improving access to coordinated, comprehensive, and family-centered care, promoting informed care and decision-making, supporting transition to adulthood, improving health promotion and disease prevention, increasing access to technology and assistive devices, and fostering community inclusion and support. Phase 1 of this master plan, there are 2 phases. So phase 1 is it's incorporating exploration, the roadmap development, and pilot testing, which is year 1 through 2. Phase 1 starts with the assessment as well as stakeholder engagement. We talk about development of the strategic plan, implementation, and monitoring the evaluation. Right now, we are currently, since we've already been proactive prior to this master plan, so you'll see in this slide what we've already been able to accomplish, what we have in the planning phases. So I'm going to continue with the next slides, but just so that we're aware that phase 1 does talk about the assessment, which is a needs assessment, as well as surveys, town halls that we've already hosted. Stakeholder engagement is just creating more partnerships, looking for partners, new stakeholders to see how they can be incorporated into resources and connecting and building programs. The development of the strategic plan, of course, once we have all this data as well as our partnerships, we're able to start developing the strategic plan and then look into the pilot testing of the implementation of these types of programs and services. And then we go on to the monitoring and the evaluation of the strategic plan. Phase 1's data, the data's role. Again, our goal for this data is to detect the gaps and disparities, track the progress, the needs and the obstacles, link services and resources, and application of techniques, treatments, and practices. So that's the role of the data that we're trying to collect to get all this information to be able to know what we're going to be applying to our strategic plan. In our assessment progress, these are our results. We had 4 town halls that were organized and facilitated back in September, October, November, as well as in the month of December. During this assessment, we did receive 177 individuals that participated and received 116 responses through the collected data or surveys that we provided in these town halls.
One question. You've identified components of moving forward. Here you're reporting on the assessment of the progress reports. My question is, for each of those sections, in my estimation, and it's limited at best, I'm not where you are, but you've already achieved pieces of each one. And what comes to mind is safety. You've already looked at training for the police department, identification of households, for example, when a person will need special treatment, all of these things. If you assess each component of the plan, from my little perspective, it appears to me that you've already done and achieved some of that. And I don't know if you want to report to City Council, you might want to hit like bullets of we've already done this, we've already, for each of the components. Just a suggestion. Just to show the progress you've made.
Great feedback.
Because you're already working. I mean, you've already done a lot.
We definitely wanted to link existing resources, and I think that was one of the initial findings when we were conducting these town halls and these surveys about. So a lot of it was just lack of access or information that these resources existed or this work has already been done. So this is also a platform to show ongoing projects. So that's a great recommendation. We'll definitely review for that.
Yeah, you can just do bullets. I mean, so that's not really because you know the thing. So, but anyway, just bullets under this component.
We had other 10.
Thank you. We've already achieved boom, boom, boom. Under this component, we've already initiated boom, 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 and have these partners from San Antonio, the Alamo people that come down and do trainings. Under this component, and that way it shows that you're already moving forward.
Did you already talk about blueprint for change? I'm sorry.
Yes, and I know as we go on into the next slides, we'll see more of what you were suggesting, because we are still in phase 1. And like I had mentioned, phase 2, which is the implementation, we've already started working on some areas, so we will mention that and highlight it. It is condensed information, but of course when we present it, it'll be more descriptive. Just for PowerPoint presentation purposes.
And this is going to be accompanied by a document that further details that. I know Christine may have made mention of this, but this is also tied in based on the research that we did after the council directive to tap into all this, into a national blueprint for change for children and young adults with special needs. So we're trying to integrate that into that kind of national level master plan, but making it culturally appropriate based on the needs of our communities. So this is why the town halls were very important, surveys, and we do see, based on the initial response, it's limited. It's a very, those statisticians and data people like Dr. Chamberlain's again, you back there, you know, we would have liked a better sample, but it was a great starting point. And please know that this is a living document. So there's so many other components going in. We continue to pursue grant opportunities for projects that are in this realm. So at any point that can also be enhanced with additional sources that we receive. So we have in internal discussions also addressed that the planning of this, so it'd be kind of a 5-year, we're kind of planning for 5 years, but because we want to revisit it pretty quickly in the event that, you know, we do see this kind of fast change in this realm. So I'll let Christina continue.
In phase 1, we had mentioned partnership building was one of the, stakeholder engagement was one of the area focuses. Here we do talk about how we want to identify the key stakeholders, engage with them, establish roles and responsibilities, foster the open communication, and evaluate and adjust as needed in phase 1. And currently, as far as what our progress is in phase 1, on the national and state level, we do have support from Congressman Henry Cuellar, Senator Judith Zaffarini. We now have a supportive letter from the Maternal and Child Health Unit Director, the Title 5 Children and Special Health Care Needs Director for the state of Texas, Early Childhood Intervention Project Niños, and Texas Council of Developmental Disabilities.
Yeah, I think in there, do we not add the Texas Workforce of Vocational Rehabilitation?
We do,
At
again,
the state level, because that's state, right?
yes,
Yeah.
we can add, that was going to be my question to the committee, was that I know we have the Blue Ribbons Committee for People with Disabilities, and we can have a subjective bullet point of the members and their organizations so that they're aware that it's school districts, Texas Workforce Commission, or would you rather have it individually?
I think VR is a big deal at the state level because they've got the money. They're not an entity where you're going to go and they're going to, you know, as long as you've got that qualifying disability, right, that you're going to go and they're going to turn you away because lack of funds. They got the money. So we need to assure that when we're aligning, right, that or referring people with a qualifying disability, that they're going to have the money. Because, you know, you've got a lot of these dead referrals, right, that, oh, go here, go there, oh, we don't have money, oh, the budget finished, and but they got the money. So it's important that we highlight, I think, because they're at the state level, they're
Individually.
TWC.
Not only that, but VR does have, as long as a person has a disability, it's perpetual. They can
That's
come
right.
back over
Yes.
and over and
Yeah.
over again. So it is it's
From
a-
14 and up.
So we can do that individually, and then we'll also look into, because Title V is connected with Texas Workforce Commission automatically because they're partners with Title V Children and Special Health Care Needs, because they're the ones that transition the
Right, the transition
kids.
counselors.
So we'll look into see how we can make it pretty and make sure that it's not too much, but just enough for we know we have these individuals.
Well, then it brings value, right?
Yeah.
They've got money. So we need people that have money that can be true. I mean, when individuals are needing help, you need money, right? To assure that if it's training, if it's a doctor, whatever it is that they're needing, that they've got the money.
And the city level, we do have our the City of Laredo Mayor as well as our Blue Ribbon Committee. We have Mid Rio Grande border area of Texas, South Texas Development Council. We have Brighton Center from San Antonio, Texas, as well as the University of Texas at Austin Neurodevelopment Division. Phase 1, as we are in phase 1, we're looking for recommended improvements. 3 of which we wanted to voice out to see and get some feedback and recommendations. 1, we do want to higher participation in surveys, town halls, and all kinds of mind assessments. We received 116 responses. Of course, if we work with outside stakeholders, 116 is probably 2% of what our population is, or maybe even 1%. But we want numbers just so that we have this data to take back with us and help it be supportive information, as well as get the feedback of everything from access to care, community inclusion questions that we might have. 116 compared to our population rate. Again, we want a higher participation number in being able to receive this
When
feedback.
you're doing your survey, who are the stakeholders you're wanting information from?
Well, the current surveys that we've only conducted were during the town halls, and that was just towards the autism community. Again, as we go,
I'm sorry, because I'm just thinking in terms of, you could do Survey Monkey or something like that if you want just from the general community, or you could maybe zero in on the college population or whatever and just send it out. But having said that, friends of mine who do major research, even when they do Survey Monkey, they don't get a lot of surveys back, and they have to go back a second, third, fourth time to try to get more data in if you're getting, because you don't always get surveys back. I mean, you don't.
it could be a virtual one. I know when we did town hall, we were in person, and then we went to different districts in different areas so that it was accessible, as well as being a virtual one at the end. Of course, as we went on towards our town hall, participation diminished. But again, and you'll see in one of our recommendations towards the end as we move forward, since our participation in the town halls was just focused solely on autism and families, we wanted to see if you would have any recommendations or feedback on possibly looking into opening the participation to all disabilities. So we get more information, more feedback, more responses to help support this population, to give us numbers and make sure that we have all voices heard.
We'll make sure to send the PowerPoint for an additional review of the members, and you can email us back your feedback, because I know some people are kind of restrained on time.
So on phase two is the implementation, which is year 3 and 5, building stakeholder capacity and continuous partnership building, evaluation and continuous improvement, and sustainability. Right now, as far as phase 2, the progress we have as in the area of quality of life and well-being, we've already have active projects, which is the inclusive childcare workshop, adaptive aquatics water safety program, provider and stakeholder pledge. There is a video on the next slide that will show you that that connects with that project. Emergency preparedness education, multi-sensory room projects, IDD recognition and response for Texas Commission Law Enforcement Accreditation. Right now we are in the planning phases of autism exercise programs, inclusive physical activity programs, and sibling support projects. This is for the pledge that we have.
So part of the initial council directive was to engage private sector entities on a pledge to learn more on how to be more diverse or apply diversity, equity, and inclusive measures. So with that, we've developed a program that would be worked through our building department, because that's who sees all new or renewed applications.
Any new business that comes to Laredo will be met with this, like championing the DEI for our community, of course, for their own organization and their employees, and then just championing the awareness for it. So we're very fortunate that our business department is budding with us and seeing the beautiful light that is radiating from, of course, this group and the work that we're doing, and planting the seed there with every new person, whether it is a child care, whether you're a doctor's office, whether you're another HEB. Everybody has to start off at that office with the building department, and we'll get this video.
Right. That's great. So it's two-pronged approach. It's internally with their employees, how to be more aware of different populations that might come into your establishment, and then how to service that client pool. One of the gaps that we also saw was that for building to be able to provide that information accurately was, okay, how do we do that? Like, obviously, we have staffing constraints. We can't really assign the one person specifically. So Christine and Tiffany came up with a great idea of having a video in English and in Spanish that every new business owner or applicant will see. and then at that point decide whether or not they want to take this pledge. And then this pledge comes with some responsibility. They will be requested to take some trainings that will be looked after by the health department. And then on the completion of those trainings, they would get a level of recognition.
Yeah,
So
we're
it's
bringing those in right now. Tiffany went to go get them. There'll be first a decal for your business on your front door, of course, from the inside that says "I took this pledge," and then we'll have your bronze, your silver, and your gold to let you know the tiers of the level. But just initially, even being a bronze is showing that it's demonstrating to the community that we have these 3 trainings already for our staff, and we can continue to work at them.
Based on some discussions from, I had the,
So just so you can pass them down, sorry. So this would be the pledge that would go on the decal on the inside, and then these, of course, would go ultimately around that, which would be your gold, your bronze, and your gold, bronze, and silver.
so I was fortunate to be present at the legislative trip last week, and we did have some discussions with the commissioner for the employers from Texas Workforce Commission. I know there's also recognitions by Texas Workforce, so there's already also some discussion at maybe perhaps the gold level, if they qualify, and we can guide them through that on what the metrics are to be identified from the state level with Texas Workforce as an inclusive employer, then that would also provide them that additional recognition. So we're definitely trying to integrate a lot of the things that are already in place to promote, this is the way to go. This is what makes an improved quality of life. So that's what we have so far, but we can show you the video.
The Inclusion Pledge is a pledge made by organizations and businesses to cultivate a culture of diversity, equity, and inclusion. The pledge specifies particular behaviors and actions that organizations vow to implement in order to provide a welcoming environment for all visitors and employees. The components of the Inclusion Pledge include encouraging diversity in hiring, giving inclusive mindful training, and establishing flexible service arrangements. The Inclusion Pledge's goal is to develop inclusive and supportive services that promote fairness, equality, and respect for persons with unique healthcare needs. Awareness for both visible and non-visible disabilities is important for promoting inclusiveness and understanding in society. With greater awareness, people can become more sensitive to the needs of individuals with disabilities, and organizations can implement more inclusive policies and accommodations that better support people with disabilities. This includes recognizing the challenges faced by people with non-visible disabilities, such as discrimination and stigma, and taking steps to address these challenges. Additionally, raising awareness about disabilities can help reduce stereotypes and assumptions and promote greater understanding and acceptance of all differences. The Inclusion Pledge medals refers to the different levels of commitment that an organization can make to diversity, equity, and inclusion. Different organizations may have different levels of pledges, but in general, the levels represent a progression in the level of effort and commitment that the organization is willing to make towards the diversity, equity, and inclusion. The following are the medal levels. Bronze, basic level. At this level, the organization commits to set a basic DEI principle, such as implementing 3 diversity and inclusion training programs. Silver. At this level, the organization commits to set a basic of DEI principles, such as implementing 6 diversity and inclusion training programs. Gold. This level of pledge is the highest level of commitment, indicating that the organization has made DEI a top priority and has committed to completing 9 diversity and inclusion training programs. The exact levels of inclusion pledge can vary by organization, but the goal is always to promote the culture of diversity, equity, and inclusion within the organization. The Inclusion Pledge can bring numerous benefits to the organization that makes a commitment to to DEI. The benefits are improved customer engagement, morale, and displaying diversity and innovation. The Inclusion Pledge can also help organizations to comply with the anti-discrimination and equal opportunity laws and regulations. Making a commitment to the Inclusion Pledge can be a valuable step for organizations looking into creating such a commitment. Organizations can join the movement of the Inclusion Pledge and make a meaningful commitment to creating a more inclusive and diverse workplace. And don't forget to make it a public commitment. Announce your commitment to the Inclusion Pledge publicly and share your plans and goals with our community for support.
So that is the video. We have it in English and Spanish. This is what we're going to be working with in our building department. Again, our building department is trying to fluently learn some of the information that they want to be able to present to building or new businesses. But we felt that if we were to have that form, that pledge, and that videos, and it's especially accessible in different English and Spanish, they're able to better deliver that message and have more support to being able to take this pledge. Phase 2 progress and access to services. Right now, we currently actively have the First Responders Assistant Registry, what we had mentioned earlier in the meeting. And then we've also championed here at the Health Department the Inclusive Vaccination Administration. That's through the training through the University of Houston, as well as Texas Council of Developmental Disabilities. We are currently in the planning phases of starting this month and ending at December 2023. We have events and access to services in child development screening assessment for early detection and pathways. We also, as I mentioned, the Road to Recovery, supporting children with intellectual developmental disabilities who experience trauma. We have the STEER program that is coming into fruition. We did get in contact with the CMO for the Santa Rosa's Children's Hospital. We are planning a trip to look and collaborate and see what type of services we can link and work further into seeing what we can connect with in resources. And then our health department, through our program, is going to be going through a hearing and vision screening service training. Again, we have different programs that are going to be getting trained by Texas Health and Human Services so that we can offer this additional services, especially for our population, to the health department. Phase 2 progress of financing of services. Our program and other caseworkers are currently Texas Navigators. This is going to be key for our population, is to be able to offer Medicaid, Children's Health Insurance Program, which is CHIP, and supplemental security income. We have an SSI training that's coming to our health department so that we have caseworkers as well as our program certified or have certifications to be able to assist the application of SSI and educate the families. And we're going to continue educating and planning with the families in regards to hosting our educational webinars on understanding SSI, Medicaid, SSDI, and Medicare. We also have special needs planning where we talk to the families about Medicaid waivers, the changes that legislators do throughout the year, preserving benefits, government benefits 101, as well as the transition tips for launching your special needs teen into adulthood in preparation of financial need. So as far as financing of services, of course, in this area, it's very broad. We talk about private insurance. We talk about finding organizations that provide resources for where they don't pay out of pocket. So a lot of that, again, as we start developing this master plan, at the end of the master plan, we can have that resource page that solely focuses on that. Sorry.
I know, it was a little lengthy, and it has a lot of information that we know based on our audience, which for BRC and autism, it's a little bit more detailed. We are going to condense it for time purposes for council, but definitely taking all your feedback into consideration. We'll revamp it a little bit so that we can have all the information where it makes sense. But we're very excited for this initiative. Like you said, there's a lot of work already in progress, but finding these additional resources like the National Blueprint for Change, and just, continue to pursue grant opportunities and just to support, having the momentum, even in discussions with other neighboring communities. Once you have elected officials buy-in and you have that spotlight, you kind of have to run with it. So that's what we're doing. And I mean, of course, we're very thankful to come across people that are very passionate about this realm, and we're just here to support and give them the tools they need to do the great work that they do. So
Yeah. One thing I would like to mention, this decals that you all are doing, I think it would be great if we had a plan to do something for the daycares, right? Because this is how it all started, right? That
Right.
lady went to council, she didn't have anywhere to leave her child, she couldn't work or do anything, didn't find an appropriate daycare. But imagine if you did that decal for those daycares, that would be huge.
And they will be part of this. I know
Yes.
we're posting additional. They did have a workshop back in.
Yes, we had a workshop back in July 2022. The topic on that workshop is creating a more inclusive environment and learning the financial successes that they can have of lower ratios and having a more 50-50 of a population of typical and atypical children and the benefits of it.
Yeah.
We do have an upcoming workshop on February 25th. This one is introducing a training of red flags of developmental delays, as well as we're partnering up with Laredo College to do a training on the but CDC is pushing for the ASQ. And so we're going to be educating the learning centers on doing their own ASQ-3 in their learning centers for families and learning the approachability towards the caregiver. This is going to lead up to a March event that we have coming for the childhood development screening and assessment that we will have on site.
That's awesome.
And what's great is that we get such good response from the child. Like, they're craving this information and
It's needed.
wanting that training. So
needed.
we see the attending list fill up within 30 minutes.
Yeah.
So
Now, this meeting that we were at, right, with that initiative that AHEC and Baylor College, right, are putting together, Dr. Garza, he's a pediatric neurologist, and he mentioned he's housed at Gateway, and he says, say I see 50 patients in a day. Out of those 50, 15 are autistic. I mean, that's...
No, the numbers are so...
No, it's skyrocketing.
So what we're also trying to do is, I know Laura Buckner is going to be coming down from UT. She's actually going to be one of the speakers. She's partnered with us in the Road to Recovery, as well as other educational support resources that we have for our families with the Aspen program that they have. We also want to just educate providers here of the process of the diagnosis and then the avenues of the diagnosis, because like we had mentioned, whenever we've received a lot of feedback where families are just getting diagnosed in schools, and then we ask for the outside physician, or of course we try to
The
push.
physicians just go PDD, but the diagnostician, the school psychologist at the schools have the responsibility of
now what
setting
are we-
spectrum to the children, to the parents, which is very, very difficult.
Yes, and our goal as a program, and especially with the workshops that are upcoming for providers, is to really educate them on the process and the linking or the referral system of where they should go next. Because what is happening is that a lot of pediatric developmental doctors are not in the lives of these children, and they should be.
That's true.
And what happens is once they're diagnosed, they live with that diagnosis for the rest of their life without getting their 4-year screening and evaluation.
Christina, there was a really cool, forgive my scholarly language here, vocabulary, but there used to be this really cool trifold that ECI put out, I guess I should say more highness than my time when we were doing diagnostics. But it was excellent because it was quick and easy, identifying anybody. It could be a physician, it could be a parent, it could be anybody. You look at it, it's at the edge of the child, what he should be able to do physically, she should be able to do linguistically, what the child should be able to, I mean, it was just boom, boom, boom. And you're talking about quick identification. That, I might even have one put away somewhere, because I remember.
Yes, much
Do
of
they
it,
still have
yeah.
that ECI rifle still?
They, from what
It's a
I'm
quick
not
reference.
sure if they do, but as far as what the screening tools and assessments now, we're trying to connect with the university because there are 5 initial ones, and CDC is supporting those 5. It has to do with behavioral, autism, ASQ, MCHART, and then ASQ I think S3. If I'm not mistaken, there's 2 ASQs. But again, we look at it, and I've had families come to me and I've asked them, okay, so you've already taken the MCHART. No, what is that? So your child was diagnosed with autism, but you never taken an ASQ, MCHART, or anything. So there is a lot of the goal for that too is that, okay, you might be diagnosed with autism, but you might have a learning disability, you might have a behavioral disorder, you might have this.
I'm
So
gonna have to.
okay, sorry.
Sorry. Yes. For the sake of time, I do apologize. This it's a master plan, right? And it's citywide, and there's so many, components and prongs to it. And we have such passionate individuals. I would encourage perhaps a side meeting to kind of start discussing about linking, or making sure all that information is put into this master plan. Again, this is a PowerPoint. We are developing a document that's gonna, again, living, breathing, but that's gonna also be a repository of all of this. We will share the link with you so we can get feedback on that as well. Constant revision at this point because we want to perfect it and we want to include all of these very important
And it
topics.
needs to be on our website
So,
too. All of this.
speaking on the website, we're trying to update that. We're working with management. We did have a transition with our IT director, so we're kind of just trying to stabilize
We
on
need to
that.
get the new members' pictures
But-
up, and we need to get an assessment and kind of knowing who has shirts, who doesn't have
Right.
shirts, and
Okay.
that housekeeping.
Yeah, Tiffany, can you make a note on that, please? In terms of the website, yes, it's something we had already brought up to management, and I know that it's in the
So
works,
valuable. It
but
should be there.
we'll be working on that.
And updated each.
Very, very important information based on the last week's council meeting. There was a motion by Council Member Vanessa Perez regarding a special needs committee. We revisited the minutes just prior to this meeting. It did talk about further enhancing BRC with the Autism Coalition. So what we're seeing is that BRC, and kind of what we already were handling internally, BRC would be the umbrella, Autism Coalition would be kind of a subcommittee, and then what they requested ultimately after our presentation, and you can go back, this is public record, you can visit and view the presentation, view what was discussed with council members this last meeting, was a subcommittee for individuals with special needs and or their parents to get that component. That was already in the works with Christine's program. We're going to get clarification on whether we can do that at a program level or if they want something official with city council appointments. Once we get that feedback, we will let you know. But know that this is in the pipeline and it's in the works. We are scheduled for next Tuesday again to present this
Next Tuesday?
to City Council. I will keep you posted.
Let us know the time.
Yes, it's usually at 5:30. We will, and if we do have representation from BRC, we can ask for the item to be brought up. If you want to do public comments, we can definitely organize for that as well. Or as BRC members, you may be called up to the podium to speak. So we're already planning on that.
In terms of supporting you or just.
Yes, definitely. One last thing, please mark your calendars. I've been meaning to send an email, but I was finalizing details with the mayor. The governor's committee for people with disabilities is coming and meeting in Laredo next Thursday. Is that the 23rd? My computer shut off. Their meeting is going to be 8 to noon at the Laredo College Falcon Executive Conference Center. They were requesting a presentation by the Blue Ribbon Committee. We do have preliminary presentations because we've been presenting to council, ready, and it would be, upon your discretion, Mr. Chair, if you wanted to present, or we've already made arrangements to present as the city liaison, so we can discuss, internal.
I guess, if you all already started with a presentation, you all can go ahead and do that. We can just show up to
We
some
could just be your
Okay.
in
cheerleaders.
case they want
And
us
they
to.
might have questions for you particularly as the local
Yeah, that
committee,
would,
but definitely they want your your
Okay, in the morning,
attendance, 8 to
fantastic.
about noon, yes.
What, I'm sorry, what time is it at?
8 to about noon
8 in the morning to noon.
In the
Falcon.
college?
at Laredo College, Falcon Executive Suite, that's the main.
Yeah,
What?
it's at the
The
EDC part, right, economic
Yes.
development?
You'll send in an email?
I will send you all the details. Laredo Community College?
that's the main
The
campus.
main campus,
Yeah.
yeah.
It's at the EDC,
Yes.
the economic development.
So, I will get you all the details. I'm still pending an agenda. The reason I've been holding off on the email to you guys is because the mayor just confirmed also he will be in attendance to provide some opening remarks. So that's really exciting too. I think it's just perfect timing with everything that we're doing. The support of the newly appointed mayor, reappointing him for this committee, and then all this that we have in the works. So we will be reporting this to the governor's committee next Thursday. We could also kind of time, if you wanted us to do a portion and you could do a portion, that's fine as
And
well.
this
We'll
is the
show you-
presentation that's gonna be done?
I'm sorry?
Is-
Yeah, I hope it's this. that you
Is it this
present.
presentation?
It's a little lengthy, I think I have like
Yeah.
10 minutes.
It needs to be condensed, is
But-
what I was gonna say,
okay.
Or
right?
just kind of when you present, kind of skip over, just do just keep going.
Yeah.
If you have any
I
questions,
talk a
I'll go
lot.
back.
Yeah. Okay, we'll work on that for sure. But yes, we'll use
But
this
I love
one.
that presentation.
Thank you.
Excellent.
Thank you.
Really good work.
So definitely a collaborative effort.
Yes.
And a lot of aesthetic feedback from Dr. Chamberlain.
A lot of
And just to get elevator speech.
Yeah, I know. Because she gets so passionate, and I did that too. And I just had that done at a meeting too, where they're like, "Okay, you need to stop because we need a." So I'm sorry,
Yeah, no,
I
no,
feel bad. I just went through it, but I know it's run long. But those were the two big things I needed to share. So special subcommittee and this meeting with the governor's committee next week.
So this special subcommittee is in addition to the autism?
Yes, they
Okay, so
wanted.
there's another committee.
Right, they
Yes.
wanted a parent, like
Just wear the
parents,
umbrella.
or
Yeah.
a person with special, like that component for that population. But again, we're sorting out the details with management. As soon as I have all that
So
stuff,
So
I will
is
share
the
that.
idea that it would be a blue ribbon committee at
The
top,
subcommittee.
okay, and then there's subcommittees having to do with the one that you just mentioned, having to do with the ad hoc?
The
I wonder
part-
where ad hoc fits.
So the ad hoc,
Well, one of my concerns was that there was a very similar language to what we do.
That's what I thought.
and that
Okay,
was the original language, but once that we made the presentation to council, the motion was revised that the subcommittee they wanted to focus on was on either like a parent population or a person with special needs to be part of that subcommittee.
A stakeholder. I can agree with
Yes.
that. Oh, this is tight. I'm
So that-
thinking when you wear these, you look like a duck. And your glasses are problem.
And I believe the minutes are already posted for this committee. We could retrieve them and share them with the committee as well. But the original language was seen, we kind of, we didn't know what the mayor intended with that. We don't understand, which is why, we alerted you and, made sure that you guys were aware.
I was not aware, I didn't know whether they were aware that we existed and what our purpose and intentions
Oh, no,
are.
we were gonna be
And
changed
what
or
our mission
something.
is, and so when I saw that, I was like, well, that's very similar language to what,
Is it
It's
said
the
away?
same, it's
Yeah.
actually the
and I was
same.
like, okay, so.
Like we
what
changed
does
the
that
name?
mean?
To go, I don't want to go there.
Right, so, and that was presented to them,
Okay.
so at that point, it was revised to get a subcommittee for stakeholders.
But that's a good question. I mean, what is the reason
What
behind it? What is the goal?
Yeah,
The
What we
mission
want,
statement,
right?
yes, the
because that's
statement.
what we do. We
So,
have a special
right, so we can
education.
understand what is the rationale behind it and what are the goals? I mean, other than this committee and then the subcommittee, what is the goal of this? And what is the expectation so that we can make an informed decision, right?
Yes,
Yeah, and if it's other bureau.
Yes,
Yes.
I
right.
thought that was it, the same thing,
Yeah,
that they
that's what I was
changed.
like,
I
okay,
was like
so now
confused
what?
also.
Yeah.
So
Excuse
what
me.
we're seeing
Bye-bye.
is that this is a representation of the different agencies that provide services, and the subcommittee would be like participants or parents of those diagnosed with a disability or special
And the
needs.
goal of that
So
is
the-
what?
so
To
To have-
provide feedback to you on any.
For them to provide feedback.
Almost,
Okay.
So
almost
the
as if
only
it's like a
difference
community
is-
support group.
Okay.
The ad hoc would have the interjection of parents
Correct.
And
and
individuals with special needs.
Yes,
And then they would bring it to the Blue Ribbon Committee, I'm
yes.
assuming. I mean, I don't know.
What would be discussed there would then be brought to, or recommended
Have
to BRC for
timelines on.
potential action.
Where were we, Mr. Chair?
Well, the item 5, the Autism Coalition, it was placed here. I don't know
So-
who was going to make a presentation.
No, we were just providing that information. We are meeting with them tomorrow to also present this. We wanted to present it to BRC first for any feedback. We will be presenting it to them, just kind of a result of their input and what they've been meeting on, and then sharing just this motion from last week about them being kind of under the umbrella of BRC, and then this creation of the new subcommittee.
I guess the only thing I'm concerned about is it, forgive the language, but it seems as though we're overlapping purposes or what we are here for. And so everybody, we need to know what our role is, because if not, we're going to disillusion a lot of people, okay, about what's our purpose here.
And the actual, okay, what is it for? What are the outcomes? What, very clear, because it can get very messy very fast.
Yes,
Right?
exactly, and that's what
And it could become a competition.
Yeah,
That's what I'm afraid.
just clear, concise, okay, the purpose, the goal, right? What's the mission statement or what? Because, okay, so here's the committee, and then, okay, we're going to go, wait a minute.
Yes.
Let's
Well, my
understand
impression
first.
was, okay, so are they not happy with what we've been doing, and so now there's an ad hoc committee being suggested or recommended, and so if that's the case, then
I don't think it has anything to do with that. I
I
think it
don't
was
believe
just,
so either.
Yeah.
I mean, we did with this new body, governmental body. We do have new council members as well. They're learning what exists throughout our organization. We are advising them. Sometimes what's placed on the agenda is placed and we don't see it until it's posted. So then we are kind of working retroactively and providing this information to them at the council meeting. What I could recommend is perhaps, and I think when the committee was established, there were some, meetings placed with mayor or, mayor and the director to get clarification on all of this. That would perhaps be my recommendation, is we could see through mayor's assistance, through Dr. Chamberlain, to see if you all can request a meeting and then have clarification on these, because I can't speak for them either. So on intentions, goals, structure, I think that would be beneficial for all to kind of understand, and perhaps make, now that once they're aware, once you all meet, then they can get a better idea of how they want to move forward.
that's fine. No, that's fine. I just was not aware if I was the only one that was getting that impression, and so I'm glad to hear that we're seeing, and I was not the only one who received that impression, and I was a little confused as to, okay, so how are we going to distinguish our roles? There's an ad hoc committee now doing very similar work, and efforts as just like the Blue Ribbon Committee. So how do we, who's going to do what? And are those members going to be a distinct group than this group? Okay, and so one of the things
Well,
that we
wait.
need to do is not start to overlap each other.
Yeah, I'm confused because I just heard Christine say, not Christine, I'm sorry, Erica say that it is a committee of parents and individuals with disabilities, right? That committee, right? The ad
Yes.
hoc. So that committee, right, that is planning to be formed, right, or in the works, then I would agree or believe that then that would be brought to the group and they have this concern or that concern, kind of like the Autism Coalition, right? Not that there's going to be any, I don't know, are they going to do anything formal at that? I don't know.
We're
Does that-
trying to obtain clarification on that.
Okay, because the way I'm understanding is they're gonna have a committee, parents and individuals with special needs, and they're gonna have a roundtable, have their discussion, and that'll be brought to the BRC, and then we get to work and see how we can assist.
Right. And that is another, when this motion was made, again, perhaps there was limited knowledge on the fact that we were already working on something like that on the department level, on the program level. We're presenting that to council, so we're getting clarification on whether that remains at a programmatic level,
Yeah.
or if they wanted to formalize it into an actual committee recognized by council members and having them appoint members. If that's the case, then additional
Yeah.
administrative
So-
functions.
So right now, we don't know, really, there's a lot of
We're still
questions.
planning. We're still
Yeah,
planning
everything's in the works, and there's nothing that is clear.
Right, and that, I mean, we're very transparent, we wanted to
Oh,
know
yeah.
the pulse of it. Some of the questions that you have, we may have as well, which, I mean, again, my recommendation would be to perhaps, just do a touch base with mayor and perhaps some council members to have this discussion between the committee and them. Sorry, I'm not contagious, I promise. I got tested for everything yesterday.
I hope you're good.
That's it. Okay, so
Okay.
then there's the remaining letter D, letter of appreciation.
We no
to-
longer have a quorum, Mr. Chair, I'm sorry. Yeah,
That's you.
right? Everybody's gone.
I'd like to make a recommendation.
Go